Bunions can be unsightly. Sometimes they can be painful. People often blame the shoes they wear, but that might not always be the case. Dr. Christopher Labos joins us. Hi, Chris.
Hi, Miss.
So, Chris, we're talking about bunions. What is that exactly?
So a bunion is basically a deviation of the big toe of your foot. So if you imagine this is what your foot looks like with your 5 toes, when the big toe is deviated inwards, the outer part or the proximal part sticks out and forms this little bump. And that's essentially what a bunion is. It's the part of your bone, the proximal part of your big toe that's sticking outwards. So it's not a tumor, it's not a mass, it really is your own bone. It's just shifted out in an abnormal angle.
But what causes them? Because are shoes to blame? Because a lot of people say, oh, it must be high heels.
So that's actually a very difficult question to answer. Certainly high heels are not helping. I think most people agree that high-heeled shoes are the worst invention in the history of humanity. I have literally no idea why anybody would voluntarily choose to wear them. But high-heeled shoes themselves are neither necessary nor sufficient to get bunions. There are many people who don't wear high-heeled shoes who get bunions, and there are many women who wear high-heeled shoes who don't get bunions. And what's really interesting is that even when they've done studies on the predominance of bunions, yes, they are more common in women than in men, which is why people have thought about high-heeled shoes. But even in societies that don't wear shoes, women are still more likely to get bunions than men. So it can't be just the shoes. There is something genetics and anatomical going on there.
So from what I understand, though, bunions are fairly common. Sometimes they don't hurt, sometimes they do hurt, but sometimes they don't hurt. If they don't hurt and you have bunions, can you just ignore them?
Yep, absolutely. You leave them alone. The primary goal of any treatment for bunions is pain relief, not cosmetics, not anything. You know, if you go into this thinking that you're going to try this or that, a custom orthotic or whatever, thinking that you're going to be able to or narrower shoes, that's not going to end up being that's not going to be the result of your treatment. The goal of treatment is pain relief, not aesthetics.
Okay, so then what can be done about pain relief?
So you initially want to start off with conservative therapy. So custom orthotics are probably going to help. Wide-toed shoes, you can get special shoes made that have a wider toe compartment in the front that allows the toes to spread out a bit, so it minimizes the tension on the big toe. And you can even get toe separators, things that'll sit between your toes to help space them out a little bit, to help normalize the angle of the foot. So all of those are the conservative therapies that you want to start with because they're relatively inexpensive and they do work and help for, a fair number of people.
And is surgery ever a solution?
Yeah, it is. It absolutely is. You obviously only want to do that once the other simpler things have failed. But yeah, you can do surgery. The point, though, and it's just worth repeating, the goal of surgery is pain relief. A lot of people go into bunion surgery thinking that it's going to improve the angle of deviation, make their feet look better, allow them to, wear high heels again. And they are often disappointed because the surgical correction is relatively minor in terms of the angle of deviation. The real goal is to remove the pressure on the toe and therefore get rid of the pain.
Well, if it's not really clear what causes them, is there any way to prevent them?
Well, here's the thing. I don't wear high-heeled shoes. You can take that recommendation for what it's worth. Bunions become more common as we get older. And so there's a feeling that a lot of it is just the loosening of the ligaments of the foot. And there's probably not much that you can do about it. Certainly high-heeled shoes don't help because they're putting this real abnormal torsion on the foot. So if bunions are something that run in your family and you see that bunions are trying to develop, maybe prefer flats, but it's hard to make a firm recommendation. It's the type of thing that makes sense, but there's not really a lot of evidence or data to back it up.
Okay, Chris, I'm only 5'2", so I'm too insecure to wear flats, is my problem. But there you go. Okay. Thanks very much, Chris.
My pleasure. You take care.